When we actually scheduled the session for today, we completely forgot about the festival. And then yesterday we were
What?
like, huh?
I didn't get you.
When we were scheduling the webinar for today, I completely forgot about the festival.
Yeah.
Yeah.
But it's okay. What's wrong?
Yes, doctor. We're ready to go.
Is it live there?
Yes, it's live. I'll be sharing the live link to your WhatsApp.
What's it? Okay, fine.
Yeah. Okay.
So, do you like? Would you like to say anything about this one? The topic itself, like especially about accuse. How do you feel
Yes,
like?
like we
So, what
already
are?
spoke about on the topic when we were deciding, can you send the Zoom ID and password for the others to join? Definitely. There's no password. It's just a Zoom link. I will share the Zoom link right now.
I can't hear you properly, but
uh I cannot I there's no password, so I'm just sharing the Zoom link. So if anyone clicks the Zoom link, they can immediately join. So if you want to share, please do share with the Zoom link. Yeah, coming back to the topic, like we spoke about when we were deciding the topic, we wanted to have a very a topic where everyone has to relate to more. The strategies of a case taking or case receiving, and case analysis in acute, subacute, and alternating disease. This is our topic for today. Uh, acu- for me, probably prescription for an acute or case taking for an acute disease is very important, because it is, we can't sit and take an hour long case taking. We can't do an full fledged history taking or a mind space or a mental space. So it has to be quick, and people's perception has to break over there, saying okay, they have two perspectives. Homeopathy has two perspectives, saying homeopathy works only for acutes like cold, cough, and all, or else it is a long acting medicine. So something like that is, it is very necessary to break the stereotype, saying it is not just for short actings like cold and fever, or it's not a slow medicine. For that, we need to understand our pathy in depth, of what to take while you're taking a case, and how quick to prescribe, or how apt to prescribe, that we find results. I think that is a main motto of today's today's session. Yes, doctor.
yeah, fine. Actually, I don't think so. I can cover all the topics. I have just focused primarily on acutes.
Yeah.
Just a second.
Regarding the link, I hope you can all see the link and you can share the link. The link is also shared in the WhatsApp group. So if anyone's in the WhatsApp group, they can also already go and share it. Sneha, yeah, Sneha, you can share the link which is in the chat box below, or if you're in the WhatsApp group, you can share it via WhatsApp group. Yes, doctor, you can take over. I will give you the access for screen sharing. You can screen share now.
Yeah, you
Yeah.
have given already.
Yes, yes, I've already given.
So, welcome you all for today's topic as such, strategies of case taking and this case analysis as such for acutes. Um, so, I have tried to present some of the cases here, some acute cases. Uh, some might feel, is this what topic was about? But at the same time, it covers the heading as such. So, I'll start presenting the presentation directly. And I have some of the conclusions and observations to make. I hope so. That would be clear. And whatever she proposed, Rashmika has asked it for, it has to break a jinx or something. So we'll try to see. we can actually break it. Uh, and happy Vijayadashami to all. A festival that is celebrated for good winning over the, what to say, bad. So we all are part of it. And best wishes to all of you. Start the presentation. So this is the topic that we are supposed to discuss, one after the other. Let us start with acute cases as said. So are there any strategies like usually that are said, or is it like something else we see? So is there a perfect strategy for any case taking? I don't think so. There is a perfect strategy for any case as such, in terms of methodology or anything. It's about case taking, but then again, it depends upon the patient. Like patient is the one who determines what strategy you have to approach, and his presentation or her presentation of the case's circumstances decide to go over. But then, is it all that difficult, or is it? Like there are several methods. One can keep it small, perfect, and simple to be clear. So I'll start presenting it, and we'll see. I'll start doing it directly presenting some of the cases and then discussing. Okay. So we have a case. We didn't have too much of symptoms for this case. The patient is a relative of one of my colleagues, and then he was actually admitted in a hospital in Ahmedabad. He was around about 56 years of old, 56 years of age, and then the complaints that he had were difficulty in respiration, malaise, and other symptoms. So on the high resolution computed tomography, uh, the findings were that most of the lobes, upper middle, left upper, left lower, right upper and middle, all these things were affected, and there were ground glass appearance and fibrotic changes that has appeared in the HRCT. So his oxygen levels were a bit low, but then the point was like he was not ready to speak at all. He was like in a sort of erratic mood, repulsive mood, and I didn't have any symptoms as such to ask for him because he was only answering one thing: I cannot uh, breathe properly. That's the only complaint that she suggested. But then, how would we go about? What else was there? Pulse, I don't think so. Someone was ready to share the pulse, or how the pulse rate is, or what the pulse rate is, or respiratory rate. Respiratory rate, in the sense, oxygen levels is what told, and he is constantly measuring it and showing it, and all those things are there. So, tongue is one thing that I have always advocated, that always watch for the tongue, and you can decide on the medicine. That's one thing. And then other things were like one important thing about this person was that he told in Gujarati that Kantadi guy, this is, he doesn't want to stay in the hospital. He is vexed. That's what he says. He is vexed or bored. That is what it means in Gujarati. So he just wanted to go, but he's not like trying to escape and all. He's asking his attendants to take him out. So he was like, "Take me out, take me out." And so one such symptom is like he wants to go out, escape desire to home, wants to go, all these things are just satisfied. And if you can see, along with the coated tongue, there is redness on the face, if you can see. But then, for the privacy reasons, I have covered his eyes, so no, not everything might be visible. But then there was redness of face. Based on these symptoms, I suggested belladonna, and he was actually doing good. So this is what's a chat. First, initially suggested belladonna and bryonia, but then what was needed was belladonna itself. Initially, I was like, what should we do? How to go about? The family was worried because The diagnosis was COVID positive. So the anxiety of the relatives was so much that they were calling constantly and again with only these symptoms. What else can we do? Can we help or not? In the sense they are already in a hospital. They just want some additional support because nothing else was happening. It was not improving. So after that, Ballerina he slowly started developing, improving, and if you can see here uh, in the chat itself, uh, his oxygen levels has gone to 90, and then he has become calm. You can see here where if I can get a cursor. You can see in the right hand corner, left hand corner, that he has become, yeah, हाँ अभी एकदम calm हो गए हैं. So he got calm, and then his oxygen levels improved. I actually couldn't even repetize this case, and then he got better. He got discharged, and then after coming home, also he was like, "Dr. Rashmika, can you control this? Can you remove that one? I'm not unable to go to next slide." Oh my God. Hello. Sorry, I cannot control the screen. Or go ahead. Okay, I think now I can go ahead. Okay, fine. So he got discharged and all, and then after that, he at home also he had a little bit of anxiety, and then this weakness and tiredness were there. So Bravenia helped him later on. So this was one of the cases, and then let me move on to another case. Inferences and other things I'll share, even the repetition. I'll go ahead. So, do we always get the whole scenario in accused? That's one more point. So, here is another case. So, this is another case of a COVID positive patient with not too many symptoms. And so, the patient happens to be a homeopathic doctor also, and her wife also happens to be a homeopathic doctor. And she has contacted me through a call and then on a WhatsApp, this thing, and these were the complaints. So, he had pain in the head, forehead region, above the eyes, and then he has scored cough, productive cough. Whenever he coughs, the mucus flies off. That was other thing, and then he had slight bit of fainting. Even after food, fainting feeling was there, and then barking cough. It was almost like barking. The audio was there, and then body pains were there. He was sleepless and also constipated. and then he preferred to have warm drinks, and then his appetite has been increased, but he was thirstless. Although he wanted to have warm drinks, he was literally thirstless, and he was taking once in a while. And then back pain was there, fever is not there, and all those things. And he decided to have sweets, and that this thing also smell and taste were diminished. So this was a working totality and nothing else to be found. Or this much is what we had actually. So and then um, so what did I prescribe or how did I go about? You can see the tongue. So tongue is one of the best illnesses, right? And also he had these rashes upon the hand. If you can see elevated patches, he had this itching, and then he would get this. And one more thing is that even if you can see on the right hand lower corner, he feels cold even under the sun. That was one of the other things that was mentioned, and this has been happening since 4 to 5 days. So this was the working totality. Yes. So these were the other findings, and then this is the repetition for him. So I initially started off with actually phosphorus, and then shifted to bryomia. So why phosphorus and why not pulsatilla? In the sense, it was rainy, or it was some warmth aggravation was also there, but then the changeability or other things were not there, along with the skin complaints. So it started off with phosphorus, and you can see the working totality over here. Head pain, forehead, eyes above, cracks, fissures upon the tongue, dryness of the tongue, and mucus flies while coughing, taste diminished, appetite has increased, thus for small quantities of water, constipation, cough, barking, and then forcibly the expectation getting out of the mouth, sleeplessness, cough from, and then again chill internal was there. Although it's heat, he was feeling cold, right? So that was internal chill was there. And peculiarity was there was lack of fever. He didn't have fever, but then chill was there. And then along with the skin presentations were there. And food desires and drink desires were taken down, and other taken for consideration, and thus how it's been done. So he's now better, and those complaints subsided. And what happened is that probably I failed to ask, or she failed to tell. I was asking any other complaints, but they didn't mention. But what I came to come later on is that the cough frequency, like you can see on the right hand side of the screen, that she's felt better, and her husband is having cough with mucus. That's it. And then the frequency of cough has reduced every time ball like mucus gets onto his tongue or sometimes flies in the mouth. So that has reduced. Like every time when he was coughing, it was barking and mucus used to fly off. Now that expectoration, which comes in which is scanty and comes in balls, either lodges in the tongue or it goes and again gets expelled. Along with that came this one, that he has boil in the perianal region, and before COVID, and she has given him hepa self and then silicea that made it ripen and open with pus blood. Then she probably felt like it was anal fistula or something. The pics were shared. I cannot share it here. So after that, see, actually, if the whole picture was given to us initially itself, like this one, this abscess, as well as the symptoms related to the respiratory tract, then it would have been much more clearer. But what happened is that we sometimes miss it. This it's not like this has happened in this case. It happens with many patients. Some of the patients, they only concentrate on what they want to get rid of. You ask them any number of times. You ask again and again. You ask them, can you tell me any other complaints are there? Even if you educate them, or even if you explain them that this is not how homeopathy works. Homeopathy works in a particular way wherein everything else of you is needed, whatever you have come for. But then if you have any other complaints, please mention. Even then, people, they don't mention. After 6 months, 7 months, they come to mention to us that, sir, I actually had other complaint also. I thought that it is not related to it. Probably I did this, so it has happened. I did that has happened. Some people, they don't mention they're constipated in an acute. When we ask, it is habitual, so I just didn't mention. But then when one gets cured, they do come. So here, even the pus formation, even the abscess was an acute one. So the best we could do it, go further and treat it further. So you can see he has developed a big rash on the abdomen. and then also these rashes on the knee as well as the wrist and other things. Along with that, he had the perianal abscess, and this was worked out, and anti-flu was given. So you can see this is a presentation, and if you know, most of the southern cities, Hyderabad, Bangalore, even Chennai, it has been raining. So the place where there is that is another one of the metros mentioned here. So they had this rainy weather aggravation. Usually abscesses they form in the summer, right? But then here it was in the rainy weather. So when one gets affected, most others follow, right? The wife who has approached for his complaints of corona has also actually got affected, and she tested positive. She tested positive on the next day after he was tested positive, and her symptoms were not too much. Um, but the things were she had nose block, and then I'll present a totality. It is the next line. This is a tongue. And then you can see the follow-up next. Immediately she said that they're not exaggerating. After 2 sits, I'm feeling much better. She was also started with post-press initially. And then the next day morning, nose block has increased, she said. That's what happens. We just cannot, like, we don't expect miracles immediately. And that is not necessary as such. But but she felt good, and there was a feeling of well-being. So the point is, the remedy is acting. So how it is going to go further? So since in the night we sleep, also we have fan or aircon on, and the air coming upon us, and several other things happening. Usually the morning aggravation is also there for some of the people. So in the night she had nose block, neck pain too, and later she slept well. Despite a little bit of aggravation, she slept well. So in the morning when she woke up, there was lots of sneezing, and it was probably because of the dryness of the nose and all that. So this was her totality, this working totality on the basis of the phone call, whatever she had. So these were this is what she has presented. Headache was there. She was unable to determine what sort of headache, probably dull headache. And then there was a slight change in the voice, and pain near the neck or behind the ear and this thing. And she was thirstless. There was pain also in the jaws and gums, dull sort of pain. She explained sort of way, it's like a discomfort. And then she actually had desire for cold water, but then her husband has advised her to take warm water itself. But then she was liking the cold water. And then so she really wanted to have spicy food. That was another thing that mentioned. Nose block was there, and then there was like alternating. She was dull for a while, and then she feels motivated, and she used to do, and then she was getting irritated for trivial matters. Also, she said, and then urine was dark yellow in color. The other thing was that she had two kids, so taking care of them, and they coming again and again, and she was unable to ask them to stay back or stay away. So she was getting a little irritated because of this, and that was the mood fluctuation. Also, that she had an impending menses that has to appear, so that she was not able to clearly say that whether this irritation is because of this, or that I am unable to be with my children, or I am unable to stop them from coming nearby, and probably if they get affected, what would happen, and all those things. So she eventually sent her kids to her parents' house, and they were taken care of, and they were prescribed bryonia as a preventive. I'll tell why bryonia. And for her complaints, like obviously, phosphorus was again indicated. So both of them were indicated of phosphorus, and later on, of course, had to change remedies. Bryonia have to shift to bryonia and all. So this is her working totality, if you can see. So mine alternating states. These alternating states are a little dynamic in nature. You can see an excitement followed by dullness, or even alternating physical complaints are very dynamic in nature. They're shifting from one state to another state. So they can actually be of great help in actually determining the medicine and helping them out. So that's it. What made you prescribe phosphorus in the sense? Is it some people they do ask, some of them, some of our people, homeopaths, they just tend to ask, sir, is it your favorite remedy or what? It's not like that. Whatever is indicated has to be presented. And some of them have like, whenever you prescribe, whenever you repertoire the larger repertoire, this is what you get. But then they say, you also notice what are the else are coming in the second, third, fourth, fifth place, there is always a shift and a change. So don't forget that. And this is the working totality for her. And this phosphorus was prescribed, and she is doing better. And then both were asked to take bryonia, and she is better. For her husband, older complaints and other complaints, as said, antimprove was given. So here is another case. Same family, different presentations of the same nosological diagnosis. Again, corona positive cases. So here is one gentleman aged around about 47 years of age, tested positive for corona. And then he didn't have any too much of symptoms and all, not too many complaints. Only thing is that he has developed rashes upon his hands, arms, and then feet and sole. So that was a typical presentation. And along with the rashes, there was itching and was better by cold application that was there. And this is the tongue. If you can see it, it is little, the tip is red and the tongue is coated. And later on, first day he didn't have too many complaints, probably. Then on the second day he got fever. If you can read, it is there. Any other complaints? Upon a little bit of detailing, uh, these were there. And then, as you can see here, I actually prescribed Rustox. I'll share the representation based on the red triangular tip and the other presentations that they have sent. And also, she also got affected. She also tested positive, and her son also tested positive, but they didn't have too many symptoms. So for them, bryonia was indicated, and then bryonia was prescribed because they didn't have too many of symptoms. And but then bryonia had been indicated in most of the patients that I have seen since March this year, of most of the accused, as well as around about 350 to 300 to 350 corona cases. So bryonia was almost indicated in 80% of the patients. There were other remedies that were indicated. I will mention those remedies. So, but then, so here, on the basis of whatever was indicated, first bryonia was given as preventive, given as a remedy even for the asymptomatic thing. And then I did suggest if may probably Rustox can also be indicated depending upon the generals you decide, because the person also happens to be a homeopath. And then so what happened is that these rashes, they slightly started developing further. And then you can see after 2 hours, he was feeling better. He is doing much better after 2 hours. So I asked her to get back on the next day. And then on the next day, he was fine. All of them were fine. And for him, the severity has reduced and fever has stopped. But pay attention to this one lesion on the feet, the rash upon the feet, particular feet. What happened is that the next day he developed blister-like thing upon the feet, and he punctured it. And then the sensation that happened to him after puncturing it was like as if coal was burning in the feet. Very specific, and fever has subsided, and all these things have subsided, and this has come up. So, but along with that, what were the complaints? What were the other complaints? He had slight sputum with tightness of the chest in the middle lobe, and his thirst has increased on the next day. Along with that, you can see today he's worried about lungs. Doctor said it is negligible changes are seen, but then although doctor whoever has seen has suggested that there are negligible changes, the complaints, the burning feet for burning like a coal, burning like coal in the feet, as well as the tightness in the chest. Of course, the diagnosis is already there. So he was a little bit worried of what would happen. So based on the other symptoms and this thing, phosphorus, I suggested phosphorus to him. And you can see here his tests. Um, this is the HCR, high resolution computed tomography, and this is of their son or who is it is. Okay, so these are the test reports. Something is obstructing here. I cannot see. Yeah, this is husband's test reports. So these were the findings. Few groundless opacities at the left lower lobe with involvement of peripheral lung parenchyma, subpleural fibrotics in the right middle lobe of the left lower lobe, subcentric lymph nodes of the aortopulmonary window and subcranial region. These were the findings, and features were suggestive of Courage spine. That is, of course, already has been tested positive for. Uh, okay, again another. Yeah. So this is the chest radiography of that lady, doctor, and these were the findings. But they had no symptoms as such. They were continuing on bryonia. The other one is of the son, who is of 17 years of age. So the one of the other findings is like same family is affected. They are all living in the same room, isolated from other people. But then one has severity, or the others don't have the severity. This is something that one has to understand. It's probably because of the immunity or relative levels of health and all these contributing factors. So some of them they get affected, some of them they don't. But even for these people, if you can see, although they had no symptoms, you can see some of the findings were suggestive of these things. But they are symptom free, they're able to do, and they're still under the follow up and are all doing better. For mother and son doing better on bryonia, father on the phosphorus. So this is the working totality for him on basis of what phosphorus was suggested after Rustox. And why not ask when the anxiety was there, in the sense he was not severely anxious or hypochondriac, or how arsenic would behave, or constantly being asking or doing something. He is calm, and probably they are into some sort of spiritual learning and all those things. So he was almost calm. So we cannot confirm if it is us, but then phosphorus definitely has those physical pathology as well as, of course, in this case, mentals were not too much considered because couldn't speak to the patient. And it anyhow helped. If you can see, okay, I forgot to put the follow up. He's doing better, and he's and actually 90% reduced. The feet burning has reduced and the lesion has reduced. Probably I will share in the comments today evening when this is there. And then there is another one, is an elderly man with hypertension and diabetes and chronic cough. Here again, I could actually gather only little symptoms for the acute this thing. He was tested positive, and the family was little worried. And you can see D-dimer test also, the serological, other serological indicators, and all there. The problem is like everyone was worried since he is 77 years of age and he has comorbidities like diabetes, hypertension, and he already had some parenchymal, lung parenchymal disease, cough, for which he is my patient. For he had been taking medicines for chronic complaints and all from the earlier days. So somehow, first the daughter-in-law who approached me got affected. She had only sense smell loss, and as I said, most of the cases preventive was indicated, and I had been prescribed it as a preventive, or even when symptoms are not too much, and based upon the generals like thirst, weather, those things. I prescribed her bryonia and she got well. And then after a couple of weeks, he got disturbed. So how did they expose, in a sense? Probably through the workers or through someone who has been frequenting their home. So these people were well-to-do family, and the elderly man was like, he has built sort of an empire for himself and has provided good resources for his only son, and he is very much attached to his grandson and granddaughter. He's someone who would like to spend time with these people. He would sit, read them books, tell them stories, and he has actually literally helped in shaping up of his son, and he still takes care of those things. He's like a very calm man, doesn't interfere too much into things and all. So he was a lovable man, in short. So uh, I couldn't gather too much of information except for these things. So again, for him, based on all those things, and only thing is that he had a little bit of discomfort and what to say, in respiration. Brian was prescribed actually, and then even her husband again. Um, this is a lady who approached, and then the elderly person of 70 years is affected, and his son is also affected, and he also has some liver pathology, kidney pathology, and then he also has sudden fainting feeling. That were his chronic complaints, but he also had these changes in his this thing, lungs and other things. So he was prescribed his constitutional remedy, and he is doing better. And this old man, he is also doing better. If you can read it here. So husband's report were there, and he was given remedies, and his children were given remedies. And for the elderly man, he is doing okay, but today's light, if you can see it all in the left side of the screen, totally slight, today slightly oxygen levels are dropped to 99, 92 to 95 degrees range, and back to 97 again. So the oxygen levels fell down a little bit and came back, and they were a little bit worried. They already had consulted an Anupat, what could be probably done, and they have suggested remdesivir. But again, they were the same day the reports came that it doesn't actually help and work. So they didn't go for it, and I asked them to not go for all those things and just go with the homeopathic remedy itself. So they were happy enough to take it, and they obviously had the confidence, so they just continue with it. And then since 3 days for her, the one who has approached, for me, smell and taste came back within 3 days early last week, but my throat is slightly burning when I'm eating or drinking. Secondly, I'm just having some dry cough. So she was asking medicine for herself also. I just suggested Bryonia, continue with Bryonia itself for some more days. And you can see for her husband, my husband also has taste issues for 10 days. Everything tastes either salty or bitter. He's having sore throat and a lot of phlegm. So this is how his case was worked. These are the peculiarities that were present. They altered taste. In that altered taste, salty or bitter in taste, and along with the presenting complaints and his physical, this thing, the pains, difficulty in respiration. Other than that, he was active when I spoke, and he was fine. So they were all doing fine, and almost all of them have recovered. If you can see here, good evening, doctor. Sorry to bother you at late night. Uncle is having low blood pressure, 110 to 60 last 4 or 5 days, and today he is saying he's not getting sleep and discomfort. Vitals and normal temperature is 97 degrees, oxygen is 98. Please let me know. That was the thing. So then I changed the remedy from Bryonia to Belladonna based on these things, and he was little in an erratic mood. Although it was rainy here, he was feeling it was warm, uh, and on conversation through phone, it was like indicative of belladonna, and I have suggested belladonna, and he was doing better. So the thing is, here for them, the next day, it was on Monday, and then later on Thursday, they were asking whether we should continue or not, because they're all fine, including the elderly man after belladonna. He was also doing fine. And then she was asking about her husband, like he's having a lot of phlegm inside. Uh, so he says headache too today. So I spoke to him, and then again asked him to take indicated remedy, which was natrium. That was for her husband. This for the elderly man about whom we were discussing, 72-year-old. The uncle is doing fine. That was the follow up, and he's actually doing fine. He has recovered. Only slight bit of tiredness is there. The only extra thing that I have advised is a protein-rich diet and warm food, nothing to be taken cold. And the point here is what I wanted to mention is uh, there is a great deal of there is a lot told about like People should be aware, the elderly people, vulnerable people, people with comorbidities, they are bound to die and all, but usually it doesn't go that far or that difficult or that serious. A simple remedy like bryonia or phosphorus or belladonna or hyoscyamus or ipecac. In fact, unexpected remedies also sometimes. In one case, it was podophyllum, and these were the common remedies that were indicated. And natrum use sometimes. Arsenic, or in around about 300 to 350 cases, somewhere around 4 to 5 cases were arsenic. Not every case was arsenic, but of late I could see a lot of arsenic cases which were not these related, but then they just had anxiety and other things. They didn't have any complaints of these things. Or probably arsenic was indicated because of people taking it for a quite bit of time through the, what to say, through the publicity, excessive publicity made regarding the consumption of arsenic as such. But then this is my observation, like arsenic was never indicated. So I'd like to put forth. The reason for saying it is like, how would anyone go about in prescribing in a situation like an epidemic or a pandemic? It's not about the scenario that is being created by the media or the initial reports. What you have to do, or what she has to do, is look at your own clinic initially. First of all, look at your clinic and what are the acute cases that are coming, what are the presented, what are the symptoms that are being presented, and what are the commonly indicated remedies. So it gives an idea of what is happening around in your place. If your practice is based across the cities through phone, telephonic calls, through Skype and other things, you get to know about the other places also. So you have a set of information, you have a set of symptoms, you have a set of remedies that is being indicated. How would they be determined? If you ask, you live in a locality with a particular atmosphere, a particular climate, particular climatic conditions, and for people like, for a place like Chennai, every day the sea breeze is there. There is a shift of temperature. In the morning it's different, in the afternoon it is different, but evening the sea breeze enters into the land. That's when most of the rain happens here, in the rainy season, and the sudden shift of the atmosphere is there, the climate is there. The same way you can see currently in this past 6 months, or let us say past 4 to 5 months, in cities like Bombay, there had been heavy rainfall, and then there is again what to say, sun, and now it is again raining and all those things. In Hyderabad, it was like raining, and finally this time it is flooded. It is like a Delhi-like situation. In Bangalore, I think yesterday half of the city, the southern part of Bangalore was submerged. Chennai is getting a good amount of rains. So I'm not just talking about the cities itself, but surrounding places, the entire, like the state of Maharashtra, the state of Uttar Pradesh, the state of Bengal, Bihar, and then like Telangana, Andhra Pradesh, and Tamil Nadu as such. So if you have a professional network, you can obviously get in touch with your friends and ask for what are the complaints that you are getting and what are the common indicated remedies. So you get an idea of what is indicated. So that is what probably is going to be presented in the case of any diagnosis, be it even corona. So that is how we actually should have gone about. And I don't think so people are going to disagree with this. Actually, this is how a genius epidemicus or a preventive medicine or line of treatment has to be decided, not based on the off-field work. That is my observation, and that is what I would suggest. And there is a lot of data. You can always compare it. You can always maintain a data with a software or even Excel sheet. You can manage it. So that's one thing that I would like to mention. And after that, you get a picture, clinical picture of the actual patients coming into your clinics. And then when these things come, you get to see what are the symptoms, and you can make a common totality for all these people, and then a different totality. Like I have patients from across Tamil Nadu, from across Chennai, not just in my locality, but in other places also. And then, of course, in other states and across the globe also. So for everyone, probably it differs for a while. but not. But even for all of the people, there is a frequently indicated remedy, and then there are some of the odd cases. But then in each and every case, you have to go by individualization. That is the thing. Let me go back to the cases, and then I'll come back to the topic as such. So phosphorus and then belladonna and bryonia, that's what has helped this elderly man and the family, and my family got better. The family of an elderly man, his son, his wife, two grandchildren, all are safe and fine and happy. Another two elderly patients, and of course, both tested corona positive in hospital. So this is an elderly man. He's diabetic, elderly diabetic. He's a hypertensive, and what happened is that his son, daughter, and grandchildren were tested positive, and he was fine until a period of time, and he was like not. He was doing better, but somehow he got anxious and then got into touch with some people, went out, did the test, and he also tested positive. But then he was fine till then, and he himself forcefully got admitted into the hospital, and then he developed these complaints: difficulty in talking, difficulty while walking, and the cough was like, yesterday when I spoke to him on the call, he was like unable to talk. If the mask is removed, his cough is very productive. And then in the sort of mood in which he was like, if anybody is going to come, I'll beat. That is sort of attitude he had, and the violence was there. And obviously, of course, I have not put the mentals here, but then whatever has to be put, if it is put, it is definitely going to be high sinus. That is also somehow you can confirm the remedy in practice. Like, you have the mentals, first you put out the physical symptoms. That is what you actually need to treat, right? So if it is covering the remedy and that remedy has those mentals, you can add it to show in the repertorization. But even then, without that, you can understand. No other remedy in this repertorization next to higher sinus like cuprum, ipecac, antimontar, ferrum, procera, veratrum, or not that violent, of course, in the at least in the acute phase. So this was one, and this was same family, another elderly lady. That was like the elder man's what to say, son is married to this lady's daughter. So they all live there, and she was admitted in hospital, and that was the case yesterday. And for her, she was even not even able to speak. She was not even able to go to toilet. She had difficulty in breathing, and then these are the only things that I could actually get. And of course, is that all that decided ipecac in this case? Just you put some symptoms and ipecac has come? No, not so. You can see anyhow in this reparation there are other remedies. Digitalis has come up, conium has come up, petroleum, and all those things. But then ipecac was actually prescribed, not sorinum. And why ipecac was prescribed is also based on these findings. Actually, this is a video. I don't know if I can play it. Sorry, I couldn't play the video. Um, so this is a yeah, the video is playing. So if you can hear, she was not even able to speak. She was that weak and all those things. This was her tongue, and then based on the information collected with the granddaughter, granddaughter is tested positive, but then she's doing well. She went to take care of her, the lady, and then this is a tongue. She was also thustless, and then many people think that ipecac has a clear tongue, but then there is also coated tongue. Go and check with the repertory. If you can actually find that it has a coated tongue. There's coated tongue during fever and all those things. So why I didn't consider fever in many of the cases is that most of the people are also taking, most of them were actually admitted in hospitals also. Like for this lady, she is an ICU, and it is not helping too much. But then they are giving paracetamol and other remedies also. So we don't find a pattern in the fever as such. So that's why we cannot consider it. But whatever is there still is also, it does help in this. And this case was taken up yesterday, and I'll probably share the results sometime. Hopefully she will definitely do good like others did. So what did I actually discuss? And the topic was on strategies, right? Analysis, or strategies over analysis, case taking, and all those things. Is it difficult, or is it this in the sense? Mentals are definitely important, generals are definitely important, and particulars are also important. That's what we are taught. And go for the, as for the Kantian method, go from the generalities to the particulars, and for the Bonnie-Hussein's method, go from the particulars to the generals, like inductive and deductive logic. All these things are there. Is there any perfect book, or is there any perfect repertory, or is there any perfect material America in the sense? It is you who have to decide what is perfect for you. For that, first of all, the case taking is important. Case taking should be perfect, and you should know what is to be treated and how the complaints are present and how they are expressed. And based on this, that is your totality or your conceptualization of the disease, which should actually comprise of, like in all the cases I have shared, is not just mere collection of symptoms. Obviously, mentals were considered on the basis of observation, and each and every remedy has its own mental picture. Unless if it is clear, don't put it, but still match with it while you repertorize or while you work out. You see if the remedy has those sort of these things. In all these cases I have presented, the scope to talk to the patient is very less. Patients are usually isolated, not even having the mobile phones in their hands, only through talk or something they talk. Most of them admitted, and some of them in the separate room, or even they are not in a mood or not in a position to message or talk. So once in a while, someone puts in a PP, goes and gets whatever information is there, and then they just say, come back. So with even with fewer number of symptoms, we can actually individualize a patient. Like whatever available symptoms are there, could then to make it complete. Actually, the first strategy is to make symptoms complete, like it has to have a location, sensation, modality, or concomitant. But sometimes it is not possible also. But then when you whatever collection you have added, and then add the generals to it, and very importantly add the climatic conditions, prevailing climatic conditions over there, climate or weather. So whether if it is changing, whether if the weather has been hot, humid, or suddenly it has started raining, if you can observe for past few days, it has been changing. Of course, in north, it has started to even the winter has already started in the northern parts of the country. Now here in the south northwest, monsoon winds are going to start. Northeast monsoon winds are going to stop. It has been raining, it has been sunny, it has been very humid. The rains that we have received in southern parts of the country is actually consecutive rains uh, that has been happening, and there is a shift of these monsoon winds from the southwest to northeast direction, and then because of this still we are getting the rains, and it is also affecting the conjoined areas in India. Like in some parts it is dry, some parts it has got cold, dry cold, and some parts it is wet, that is rainy. So that also plays a very important role in prevailing conditions. Add to that the societal things that are happening around; those are very important. But what is perceivable is like pulse, the tongue speaks a lot. Tongue can be your index to a remedy, your doorway to a remedy. Like you can't expect it has to be mapped tongue, it has to be like this and all. But when you start observing people, start seeing patients, start seeing the tongue of each and every patient, by the end of 1 year I think you should have your own idea of which tongue is representative of what remedy. That's another thing that you need to understand, conceptualization of this thing. Cause is very important. And most of these cases, if we get back to the details and if we understand, if we know these people, we get to know that their disposition, their predispositions, and their vulnerabilities, and what could be an exciting cause and what could be the maintaining cause. In any acute, for that matter, the cause is very important. If it is present, the remedy is much more clearer. Or any cause that can be present. And in acutes, the pace of the disease is usually fast, rapid sometimes. So when there is a rapidity, there are other factors also, like daytime, nighttime aggravation. The picture can change totally in a half day, 6 hours, or in 12 hours period of time, because patients, they just don't take the medicine that we have given. They do other things also. Someone would suggest something, someone else would suggest something. I actually have several cases, but then I think time would be too much. So I'll just limit to some of it. So the thing is, they do other things also. So the modification to disease as such is higher nowadays. People googling it, doing it, all those things and all those things. There are only few people who are disciplined enough to listen to what we are saying. So remember that aspect also. And the totality might change fast. You should be in a position to decide when to repeat, when to change. When do you change? Like in all the cases I have shown, I have changed the remedies. So the point that I would here like to mention, which is not, which is never mentioned, and some of our elite homeopaths or the standard homeopaths has taken it like single dose, miraculous cure, single simple dose and all. But then in acutes, there are several things that could actually modify the presentation of the disease. The pace of the disease in itself could take it to further. We should also understand the pathologies, right? Some of the pathologies, they are not like just one dose is going to cure. So you should be like, if there is an improvement, like in one of the cases, she said, right, sir, immediately after 2 sips, I feel better. But then again, next day, that night she had increased sneezing and all, and then the next day it all subsided. But then running nose was there, all those things. You observe it, and if there, it's definitely when there is a deep improvement, you just continue to give the repeat the remedy. And then if the picture has changed, some of the symptoms have gone, some of the symptoms are remaining, and some new symptoms have appeared, or some symptoms that were already present has not been told to you. There was again also one, I have showed that case, right, when they had perianal abscess that was not mentioned, and then later on it came back. Same way, there was a person who approached me for a sore throat, aphonia, and all those things. I prescribed Corbovich, only fever symptoms, and there he was better. After a month, he approaches me again. At the time, the cause that was mentioned was rain. That's it. Next time, he mentions that he has been getting this since 3 years, and usually he gets affected in rainy or winter season. I was like asking him so many things. He was not in a position to tell because he had aphonia. He was like typing or doing something. His wife was also not expressing too much. But then later on, I came to know that this is a common phenomenon. So initially, what I did was treat it as an acute. But then now, while treating, the even that information when it has come, we have to change. And of course, the first remedy didn't work, and the first remedy was Corbovich. And Corbovich, first remedy was this time was some other remedy, probably Baptisia. It didn't help, and then shifted to Corbovich itself. It didn't help, and then again I had to reconsider, and finally Gelsimim helped with him the other time. So sometimes what happens is the totality we get is not entire totality also. So the readiness to change the prescription is also important. And as I was telling, when there is improvement or when there is new complaints, where the information that you get with little more of the totality, then go for it. Prescribe for the change totality. That's how in all the cases. That's the case where the feet was the person had developed rashes on the feet. We had to go for phosphorus from the rustox to phosphorus. Same way, the emphasis as a point that I want to make is always pay attention to the second prescription. Second prescription is the most ignored and less spoken topic. Ask any person who is actually working in a rural area, especially those medical officers working in the rural areas. They don't actually get to take a lot of symptoms, but they prescribe. But then the second prescription is what matters rather than first prescription itself. The people who are actually working in the rural areas, they give a lot of information. Even those who work in a city, in a slum or semi-urban locality, they also get a lot of information. Be in touch, gather all that information that would be helpful, or even in your own practice, concentrate upon all these things. That is one more thing. Second prescription is very important, and one has to pay way to it. I would like to emphasis on this thing. You have like people do ask whether we want to have a software or this. It's up to you. Whether you want to have follow a physical book and you want to do. What happens here is that you don't have time to note down everything, right? And then books like Fartex repertory, they are confirmed symptoms of boring loss and all, but then they are in alphabetical order. Only most of the rubrics have fewer number of remedies. It is like it is not something with which you work out a totality. it is that book which you memorize for as a ready reckoner. You work on the totalities with the perfect repertory. Like you can use complete repertory or you can use synthesis. Even Kent, that several people ask for Kent. You can do that all that. But for something like Fortek or even Murphy and all, they were like helpful for as a ready reckoner. When you have free time, you can refer them, but always work out a totality. Having a small software, if you even don't have a software, make an Excel sheet, write down the symptoms, see what you have prescribed, and maintain a record. With software, what happens is that I'll show once I finish the this one presentation. With the software, you get the dates of the prescription. Like for example, I'll show here itself. Like you have a patient, let us say this unnamed case, I'll leave this. So when you have an actual patient here, you have all the dates that they have come up, and you also know what you have prescribed, when you have prescribed, and what for they have come up. I'll just show a small example here. Like this lady, see, she has come in the month of July 2018, and in 2019 she came twice at the end of summer on September. Actually, when the heat has reduced and when winter was coming this year, and then you can see October she has come. And she has returned back to me almost an year back, and the complaints were actually similar. So you can actually have a record of all those things. You know what are there in the symptoms, when the patient is coming, how frequent it is. When you actually have a record of all those things, we might have a case sheet, we might have paper, and we might have written, we might have a file. But then when it is put in a tabular form, you find the frequency of it. You can make several observations, whether it is periodical, once in a week, once in a fortnight, once in a month, or is it on full moon, new moon, or in between the full moon or new moon, or for the patients with, especially with the female patients, menstruation, and what is happening before, during, or after the menstruation. Most of them, they might tell, like before menses, this happens, that happens, but then sometimes it's not directly related to the complaint, directly related to what they have come. But if you make a close observation, if you have noted down these things also, details also, then you can come to know that it is happening in between this or after that or before that. So that way record keeping is very helpful, and all the prescriptions in one place also helps you to understand what is frequently indicated for this person. Also the constitution and what are the things that have been affecting. So record keeping software is not a fancy thing that you are actually purchasing or putting some symptoms, rubricating it, and then doing this, and then it has several other possibilities. It has several other utilities to it. Record keeping is one important thing, and it gives you an overview of what has been presented, what changed, and then how it has gone, and all those things there. And then um, if you can actually remember, in all the cases I have presented, it's not about one individual. These are all families, right? So the other thing that I would like to mention is that whoever has approached for a clinic for the treatment for such a trivial condition after testing positive, they were all not one individual, but the entire families. So I would like to re-emphasize the thing is that a person who is able to treat fevers, a person who is able to treat acutes, especially fevers, is the one who is going to shine in his practice. It's not about those cancers, removing the stones in the kidney and the gallbladder, removing the tumors, all these things, or like they would come. But then when initially when you are setting up to gain the confidence, what are those cases that actually gives you scope, ample full of scope to prove yourself or to show the efficacy? It is the acute cases. And fever is something everybody knows. By taking paracetamol, antibiotics, it's cumbersome and they feel lethargic, and most of them they don't like. So if you're going to give relief for fever, usually for normal fevers and all, it takes 6 hours to 24 hours of time for treating. Once you do it, they invariably come. I have a patient who comes from Sri Perambudur till here, which is almost 100 kilometers around about to my place. And even for fever, even for his kids' fever, he comes all the way. It is almost of 3 to 4 hours of travel because of the traffic, but he does come. And his entire family is a patient or my patients. Same way, when you prove yourself in acutes, actually, they come for you for everything. So much so that even if it is like a dreaded disease like this one, they come to you. First opinion is yours. And some people, some parents are like, oh, it's my kid, something might happen, we don't know. But what usually happens is that most of the parents, especially for the kids, they bring the child to homeopath once you establish yourself in treating that fever or acute. One case is enough to fetch you a family, and that family also fetches you several other families. So, well, what is the jinx in the sense? If you are able to get this, get acute done, you get lots of cases, chronic cases as well. When dealing with this acute cases, especially fevers, the attendants and parents are obviously anxious. So the reassurance given with the immediate relief makes you build a rapport also. When you have that rapport, you discuss several things to it. And when you discuss, you you get to know about other things. You could explain about homeopathy. You could explain all those things. So is the motto for anyone should be like, for a homeopath especially, is to become a family physician. If you have around about 100 families with you, you have a minimum of 400 patients at your hand. They keep coming to you. Today the scenario is every family at least visits a doctor once in a while. And when you explain about homeopathy, the scope and chronic cases, how it works, especially when they have seen NACUs, they do come. So that is how you build a practice. It's not about publicizing yourself. Publicity initially, what happens is through the social media or whatever it is, people they do come. But if you don't have the stuff, what is going to happen? So you should have an ability to work, to observe, to treat, and you can do that. The totality is like, first, who is the person, what is happening with the person, with what is happening, and along with that, one more important thing in the totality is the modalities. Usually, modalities are, if clear, would be very helpful. And you obviously need to educate patients about the symptomatology. You need to educate about what is important for a homeopathic prescription. You can ask, and after a point of time, they themselves tell everything. How is the appetite? How is the thirst? How is the bowel movements? They just get with it. Just put those changed thing, what has changed, what totality has changed, and you will definitely get it. And one more thing is that being in touch with the society, what people are thinking, could also help you to prescribe. It's not, see, you all obviously know the indications of remedies. Many people, in fact, are very good at working up a totality or even making a repertorization and all that. So for most, the tricky thing is about the potency, and for some, the tricky thing is furthermore about the repetition. It comes through experience, and it also comes through understanding. Follow those people who actually work and they treat it. That is one thing. And for a pandemic like situation, I would suggest some of these things that you should observe, general trends of what is happening around, like what is happening around us, what the families are doing of our own family, what they are doing, what they are thinking, what are their priorities, what are their concerns. And then immediately then we go to the friends, what are they doing, what is their activity, how are they getting affected, what are the complaints that they do get, and those things, and how these things have these situations has affected the professionals as such, businessmen and women, how they have lost their employment or lost their businesses, and how it has affected, what sort of complaints have come. how it has affected the freelancers, general public, and children. If you have these symptoms, these things collected and represented in one place, you will get a lot of data which would help you when the patients actually come. And we'll see uh, uh, what to say. We'll see a lot of difference in our prescription. And last thing, yeah, and what would you look for them? Look for in them is that what is the most important considerations for people in life. First thing is that the survival, the health, immediate health of health of the immediate family, the finances. How what are we going to do about the future? For example, a situation like this in which we are, once hospitalized, they're costing around about 72,000 rupees per day, and not many people could afford it. Actually, even the rich couldn't manage it. And so far as what I have seen, the scope of a homeopath is that place. Like the frugality of homeopathy is that it is economical, sustainable, and you can actually make a good living out for yourself as well as for others. So yeah, what would you actually look for these people in the sense these things, like how their employment has affected, because without employment, what are all the things that they need to face, the financial considerations, the considerations of health and anxieties and their own personalities. How did, like, if you have let us say 20, 30 friends, what they were doing in the month of March, what they were doing in the month of April, now and then, and now as such, what are they doing? How was it trending? Initially, people were playing Ludo, several games, music. They finished all the series, and then most of them they have gone into purchases. There is a lots of sale happening. If you can see in every neighborhood, there are lots of these e-commerce executives. If you had seen in the month of June, July, and all, big basket supplying groceries, fruits, there were a lot of them during the lockdown. Now that the shops have opened up, big basket is again back to the pavilion, not doing too much. So the purchasing trends have changed. The people's liking, like people were baking so many things, cooking so many things, doing so many things. Of course, people were commenting on homeopaths also, like you were attending webinar after webinar. What did you learn? Recently, I had a meme like a lady was having a big bag, more than her size. Lady entering into the clinic after COVID, which is unfortunate. A homeopath shared, but then it's also unfortunate that when there was a great scope to prescribe to people through telephonic conversation or even directly watching the people, or directly seeing the patients in the clinic as such, some of them were worried and couldn't see patients. It's a pity. We definitely had a lot of scope, and as per this person, as per government, as per this doesn't work. Everybody has to have their own materia medica, the materia medica that they have built through their experiences of cases. And of course it all starts with a single case itself, and every case is unique and every case is new. If you have 100 cases, you have seen 100 cases, they were all different. 101th case is the only 101th case, so that is the first and the last 101th case, right? It's not going to come back. See every case as a new case. Always keep the possibility open. Get whatever is there. You make use of the available resources, make use of the available symptoms, and the greater intent is should always be there. Like we should work. Our efforts is what matters. I would also like to tell, like, there is art in it. Some people they do say, of course I do agree, there is art in it. But then you take any art, any profession, without practice you cannot shine in anything. Be it music, where you need to, it's an art, right? You need to practice, practice, and practice. And in music, it is built on only those seven notes. If you know those seven notes, like saregama, everybody knows do re mi fa re. But then can you make music? It takes lots of practice, efforts, and understanding of those things. Like let us take photography. Photography is based on lighting, how you play with the light and the shades. When do you get, in what angle do you get? But remember one thing, every time you take the same object, but it looks different based upon the lighting. So here also, does not like every time you can replicate it. You practice, 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 so you get a fine at this thing. Same way painting, you can know the basics of painting, which is art again, but then not everybody can get better painting. One can say you need to have a creativity. Creativity is imagination. Everybody has imagination. Where do these delusions come from? Where do these exaggerations or overaction, whatever they say, everybody is actually imaginative. So imagination is has no limits. But the thing is, how much effort do you put? How much do you practice into it? It's all same thing, same basics. But then how you apply it and how you do it. If you give like, let us say we have a presentation. Some people they just open it and do the presentation. Some people they just put random things. The point they say is that we just need to present it. But then there is also doing it in a better way, right? Doing things in a better way. For that, practice is needed. Even cooking needs practice. But then, what makes you excellent? An excellent cook, an excellent doctor, or what makes you do better? What is excellence per se? Excellence is that every time we might be equipped of doing the same thing again and again, but to achieve a higher goal, to do something better, we need to look forward. Then the one small extra step could give you that edge over others. So the intent should always be like whatever might be available. When the resources are limited and you are still able to do something, achieve something, that is called as excellence. So always look for the excellence. For that excellence, you need practice. You do it again and again and again, and you capture it in a moment. Same way, case taking is like you read whatever. You can read hundreds of material America, read hundreds of case files. You can see, you can attend lots of seminars and webinars. You can see lots of live cases also. At the end, what matters is that your own communication, how you communicate with the patient, what sort of understanding do you have about several things in your life. A person in front of you might be anyone, an idiot, a very well read person, or mediocre person, a person who doesn't know to express himself. One thing that has to be told is like several people have lost the ability to explain their complaints. Nowadays, what we get, sir, headache, sir, acidity. When you ask, they have lots of explanations. So the strategy as such is to work upon yourself. When you work upon yourself, when you try, use all the resources available, and when you are good at actually looking for the right things, then you actually do it. And now it all comes through the experience. So that is thing. Last but not least, try to uh, know yourself. First of all, you have to know yourself, your abilities, and those things that are not possible to you. When you work upon it, when we work upon it, it all is easier. And I saw some people raising hands. If their question was like, how could you talk about the single remedy, this and all? Yes, it is definitely possible. Those miraculous cures are possible. Those PQRS are possible. But remember, PQRS prescriptions that about which several people talk, about a particular strategy they talk, they are called peculiar rare queer symptoms, right? Rarity among the symptoms. We don't find rarity of symptoms in each and every patient. Same way, miraculous cues, obviously, they definitely happen, but not every day. It happens with everybody. But then, is that what we need to concentrate or not? In the sense, I primarily see it addressing to all those people who are struggling to make a living, who if at all you have been successful, you have been doing, you have self-satisfactory, probably you not see a person like me taking a webinar. That's what I feel. It is for those people who want to learn, who want to proceed further. So this is what I have understood and learned in the practice. And we don't need to, if popularity comes through patients. The biggest jewel to a patient, to a doctor, is that patient coming to him for everything. And if you're successful with your patients, all these extra things doesn't matter. When you try to understand yourself, you also to understand others well, and that's how we can obviously go ahead. So since time is too less, I'll wind up the presentation here. Baseline, the thing is, keep things simple, work on what is available. Individualizing the patient is what is needed, and that is what is said as an art. You search for anything. Ultimately, what you are looking for is this only what are the presenting complaints. If there are any peculiarities, you go by it. If you don't have any peculiarities, you construct the totality by making it complete again. The completeness is through several strategies: location sensation, modality concomitant, or this one's side time extension, or to the concept of totality as such. Basically, what Hahnemann or Boger or Boninghusen or Kent has taught is enough. But the recording will be available. Maybe I'll share my representation also. We can actually segregate each and every case according to these headings: the personality of it, seat of the disease, and all those things, in whichever strategy you want to do. So be good at basics. You need those building blocks, just like you need the seven notes of music, or those basics of light that you need to understand, basics of color that you need to understand for painting, or basics of cooking is about taste, smell, and the what to say consistency of it. So when you know this, you can play with any sort of thing. Like if you want to cook, you need to understand about the smell of it, the flavoring of it, how much heat one thing has to be cooked, how much heat is needed, and also the taste aspect of it. Same way, for painting, you need to understand about colors, what basic colors are, how to mix them, and you how to put them, and then you have to have a little imagination. Same with music, same with the prescription that is said to be artistic prescription in homeopathy. Artistic is that you need to have basically all these ingredients and then try to visualize what is wrong with the patient, what is to be cured, and what is to be treated. So just keep things simple, things work, and you can choose any repertory or any materia medica. They are all references. You should serve your purpose of your own understanding of seeing the case, and that's the strategy, I think. And be it corona or be it any other accuse, I can obviously present cases of fever or cold, cough, coryza. But in all that, the thing is same. Take whatever is available, prescribe, and people are fine. So that's it. I thank you all for your patience to attend while attending this. If people have any doubts,
Hello, doctor.
yeah, hello.
Lovely presentation.
Yeah, thank you. யார் பாட்டு போடுறாங்க மாஸ்டர்ல?
கேக்குதா? பக்கத்து ரூம்ல.
Okay.
Next room, sir.
Okay.
Sorry,
Ah,
disturbing us. Shall
yeah.
I mute it?
No, 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 no. What?
It's disturbing. Shall I mute it?
No problem. Let it be. Net. It's music, obviously.
No, I thought it's like the door's closed, so I thought it can't be heard.
Okay. So,
Any doubts, any queries? I think we've been having good comments on our Facebook Live saying very informative webinar. Thank you. Thanks a lot. Pavel has said, nice to see you, sir. Abdul has asked, okay, nothing better. Okay. There have been so many good comments on the Facebook Live also. Is there any queries in the Zoom with the attendees? Any queries? Always insightful. Thank you.
see, the topic was different, but then I didn't announce to say that I'm actually presenting corona cases because
Yep.
I didn't want to create any unnecessary hype, I would say.
True.
The point is, it is even that is an like for what you asked, like is it like homeopathy works only for the acute cases or is it for chronic illness? If you are successful enough to treat fevers, that is how one builds his practice. And
Uh,
all you need actually to make a living is
we have a question by Monica. She's asked how important it is to repetize every case.
Like in the cases I have mentioned, I have not repertorized couple of cases. The first case I have not repertorized.
Yes.
And in later on also, I have not repertorized every case. Because if you have time, if you have enough to do, you can repertorize it. If you don't have time, but there are two ways of doing it. I repertorize before prescription, and most of the time I repertorize after the prescription to check whether it is indicated or not, because it gives you a graphic representation of what it is. The actual thing is that I mostly repertorize after the prescription to see
Hmm.
what is good. It also prepares for the second prescription. Like if the things are going better, you're just going to repeat it. If it's not going to, if it's going to present in a different way, you have it all there. I keep sharing it. I have been sharing it several times. The three phase of therapeutic pocket book
Hmm.
introduction. Like there is the second paragraph wherein he writes that drug after drug, the intervention after intervention, several after several assaults, you don't have a clear picture in most of the cases, in chronic cases, wherein you need to have a repetization, and that repetization works as a ground plan for you. Somebody might be
Hmm.
indicated initially and another later on, furthermore. So many people feel low in confidence while prescribing.
I think your voice is a little. Yeah, your voice is a little cracking. I think is that everyone.
Now,
I'll try muting myself. Can you talk?
yeah, actually, it's your part.
Just give me a minute, sir. I'll just go and stop it and come. Just give me a minute. Sorry,
So, whether you need to repetize every case, Dr. Monica, yes, of course, it is helpful to see. It is helpful to plan out the next plan of treatment. Also, when I said that if you have repetized, you know what symptoms on what basis at least you have prescribed. Even at least if you don't have the case sheet with you, you have a reference to what points you consider to prescribe them. You can also note down what remedy has been prescribed over there. So it gives also the dates, the things I mentioned, like you have days of when a person has, and you can even detect the periodicity of it and seasonal variations or whatever. Some things, most of the things they go unnoticed. But then when you have good record keeping, you can actually see all those things in a graphical way or in a pictorial way. So that is obviously helpful. So it's good to have a repetition. That's what I would say. Material
especially when it
medication,
helps
we don't
I
write,
think that's very
and most of us don't have the habit of writing down why the remedy was prescribed in our own prescription or whether we give it in our own case sheet or by giving to this. So we just note down the remedy.
yes.
In fact, I don't even note the remedy that I have prescribed on the case paper. Most of the time, my case sheet is understandable only to me, not to others. Like I have shown two of the cases that I have written, but it is like my own way of conceptualizing a prescription. I will probably show sometime like divide a case sheet into three
Hmm.
parts horizontally. Middle part is for the presenting complaints. Middle upper part. Middle part is for the generalities like thermals and desires aversions, and lower part for the mentals. And side is for the past history. Past history, like what happens is it start from the middle. Sometimes people they tell some of the events that has happened on a midpoint, and then they go back and they come forward and all. So start from the middle and have a timeline, just like a timeline. Put it in 2005 it happened, 2006 it happened. So you have it on one side, and then come down, write down the appetite, thirst, bowels, all those things. On this side, if you have any side note, extra note for the write all those things. So in one paper, if you have all those things, that helps. And what also happened is that through the practice, since I repertoire a lot, of course I do work on the repertory. Sometimes I write it down like in the repertory language itself. I don't write nose block. Most of the time I write nose obstruction. While I am taking case, I write it as nose obstruction, not nose block, because that is how it is represented in repertory. And there are several such misnomers of this thing, like pulling pain. You can find it in materia medica. You can see the patients referring to you, but in repertory, it's not always pulling. It is actually drawing. Drawing is where you have to look. So those common things that people say, chilly hot, I never write it because there is an ambiguity over it. The thing that can be written is that whether warmth is aggravating or cold is aggravating, or what is desirable, and whether taking bath, what sort of bathing they like. They take cold bathing or warm bathing, they like covering or not. This determines the thermals of a patient rather than writing down chilly hot. What is a chilly remedy? What is a hot remedy? They do keep it. Some people remember, I don't remember personally. So I write down as these aggravations and ameliorations. So it also gives a better scope in finding it in a repertory. Like chili hot remedies are no longer present in any modern repertory, be it synthesis or even Murphy sort of. People criticize only about complete that I use, but then um, that is actually workable. That helps you. Like modalities are more important than this generalization as such. And one more thing is pulsatilla is thirstless. That is what they say. Pulsatilla can be thirsty also. Pulsatilla is a very mild remedy, changeable and all. Pulsatilla can also be very violent. They can throw knives at people. So all those things are there. You can search for repertory. The people get so violent they can go. They get a mania to kill. The pulsatilla patient can get it. So it's always good to keep the things open, write it down in such a way. Yes.
Great. I think we're at the end of the session, Doctor. Shall we? It's been
Someone asked me,
sorry. In some acute case, you think the series of memories are required strategies for selection, potency, and repetition.
see, it depends upon the pace of disease in acute. I'll come from back. Potency depends upon the pace of the disease. If it is too fast paced and the person's vitality is great, for some people, like people are very violent in nature, the complaints are violent, you can obviously go by a higher potency. But if it is like patient is very dull and their reactivity is less, it is better to go with the lower potency. And repetition is like, again, depends upon the vitality of the patient. If he or she needs a push, you should obviously. I should tell some of my, I shared one of my case in my college group, and one person started fighting with me. How can you repeat a remedy? If needed, we obviously need to repeat remedy. Repetition is obviously written in order on which they quote that only one single remedy at a time. Yes, of course, we prescribe only single remedy at a time. But based on the second prescription, based on the follow-up, we can go for the next remedy. The follow-up is what determines whether we need a couple of remedies or a single remedy itself. It is how well the symptoms are present, or how well the economy of that person is person is there, and the other contributing factors that could modify the person's his or her health. So that is to be looked out, and that is how it works. Not in all acute cases you need couple of remedies. It can be with only one remedy also. Just to emphasize the importance of second prescription, I have put up some of the cases which needed second prescription.
Great.
So, what do you feel like, Dr. Rashmika? Like, you conducted several seminars,
Yes.
and how far is the awareness of that we can treat any disease? Has it gone up?
Definitely, definitely. No, in the initial when I started the session, it was not on a homeopathic doctor or the seminars. It was not the perception of that. The initial introduction when I gave that was only among the patient. When a patient comes, I think I have like 60% of the patient comes to homeopathy as a outsider who doesn't know. Only 40% people have the actual knowledge of what homeopathy as a system of medicine is, and they know what to expect from a homeopathic doctor. Or but 60% of the population they come to a homeopathic doctor without any knowledge of what it is. So when we actually start explaining to them what it is and how we treat, they would have their own perceptions. They would have spoken to few people. They would have, spoken to many. They would have read a lot about it. And that is how when I started, I gave that as a starting sentence only because of the perception of how a patient comes to us and what notions do they have. Uh, but on a basis of the demographic of a homeopathic practitioner or the webinar, I think it is lovely to speak about such cases, especially when you said that, you know, this is something which is a very important topic at present. The pandemic is, you know, I can't use a positive word saying flourishing, but it is getting expanded by the minute, by the day. So I think it is very necessary to talk about the pandemic in our homeopathic perspective, and everyone's doing so. Every doctor is trying to talk about it, and I think it's a good step forward. It is a good step forward because everyone has to talk about it. They have to collect it, data. I think that's the most important thing. The collecting data and keeping it safe is something which is very important, because on a longer run, that's going to stand still. It's going to be the pole which is not going to be hit by a storm or hit by anything else. That's going to be something which is going to stand as an evidence. That is why it's called evidence based. So collecting and saving the data of what the patient data is very important. I think that's every doctor has to try doing that, and every doctor has to, like you said, every doctor also needs to tell that why the remedy has been prescribed. No, 90%, even I don't do that. To be very honest, 90% of the doctors don't do that, of why the remedy is being prescribed. A small note on this is the basis I have prescribed the medicine. That's very important.
Yeah. So the things I actually wanted to convey a few, like I did the last one and all the couple of seminars. People usually ask some of the questions, how to do this, and what happens is that most of them they just lack some patience. They just go for the change of remedy quite often, which has to be avoided. And the other thing is that I don't want to blame any people, but then see, there was one particular school of homeopathy which initially had come up with a particular sort of theory for several things. Along with that, it came up with the theory of about this pandemic itself. The people who were following it fell sick, some of them hospitalized. One of my senior who fought right, he came back for the treatment. He couldn't treat himself, and then there was one more junior who tried out those medicines suggested by that particular school, and he got admitted into hospital. And finally, what helped him is a simple remedy. Him and his wife is a simple remedy like bryonia or belladonna. In fact, rustox in some cases like that. So now they are not even speaking about it. One particular school, they have converted the topics. They have shifted to other topics. They are not speaking about it. Initial publicity was like, we are doing this, we have so much of this, we are doing a particular procedure and all. So already who are following, I don't have anything to say to them. But then for a student, at least when I was a student, my family doesn't know too much about homeopathy. I had to set up from the everything. I have had days wherein I didn't have money to eat food. They didn't want to invest on this. So in that situation, what are you going to invest upon? The only investment I had or made was a laptop, which is old enough. I have kept it behind, and a collection of books and softwares. That was the investment, and it has all been learned hard. And why I emphasized upon people to be family physicians, to think that, to understand that the scope of homeopathy is to be a family physician. All of us are there, but they don't, there are only very few who actually connect to a family at different levels. I actually had some more cases. I thought time would be this thing. Like I had a complete case of our entire family. Again, whatever I have presented is small, but then this was a big family with lots of, everyone was positive. So 5 people in the same family and all. The scope of being a family physician helps you to have a good earning as such. Like let us say everybody is visiting you for per month. You charge, people charge according to this. For this city, let us say we are charging 500 to 1,000 rupees. And one family of 5 people fetches you 5,000 per month for only one visit. So if you have 100 families, at least 100 of them are going to visit you. 100 into 1,000 is 1 lakh. It might appear to be a very big sum, or like is it that simple to attain or that and to go over there? It takes a while. So we don't need to present ourselves like, see, I have presented these many, I have taken photograph with this person, that person, I have done these many number of courses. Like I don't even have a board now, but I am quite busy. So we have to build that, and it has to come from the mouth publicity. That is what I want to emphasize upon. And don't waste money is was the underlying thing, and we can make a lot of money just by treating acute itself. Every day we get at least there are 30 to 40 acute prescriptions if you have this many number of people. Children, they fall sick, elderly, they fall sick. Pain management, again, for several conditions that we have, that people have developed, not necessarily there has to be cure. Sometimes they get operated or something where there it is needed. And then when your family comes, when women are there, women's health, especially related to the fertility, like menstruation, childbirth, post childbirth, there is a lot of things that come in: thyroid, PCOS, infertility, menorrhagia, and then several other complaints to menopause. There is a lot of scope with that set of patients. And then with men, overeating, job related things, infertility again, thyroid related complaints. There are several other, like uh, respiratory complaints, or the cardiovascular system, or the what to say, digestive system. Engage people starts with the digestive system and then to the cardiovascular system or CNS. Elderly, the skeletal system, uh, like joints, wear and tear, all those things. And then of course hypertension, cardiovascular diseases, and neurological diseases, paralysis to semi-paralysis, skin diseases. So every now and then, like in the last few months, since August, everybody is complaining of one thing: itching in the groins, itching on the face, ringworm. Like if you can even see on Facebook, several queries about ringworms are there. I at least had seen around about 100 people for ringworm. So just by being in touch with those many number of people, you can build a life for yourself. You don't need to follow anybody. You don't need to follow any school. You just can make a living out of yourself. You just can. Everybody should make their own material America book of their own experiences. Whether you are going to write it or not, that's a different thing. It should all be in your head. Work hard, read, update yourself. The upgradation should come from conscious learning. That's what I would like to say. So that was the motto behind doing this. And the second thing is that everything is treatable in homeopathy. The diagnosis doesn't matter. Everything in the sense, all those medically treatable diseases, some of the surgical cases also. Where the thing is, getting a case itself is a rarity. Like it's not happening to everybody. Not everyone is going to. Not every homeopath is getting every case, right? Even if they are ready to come, some people they don't want to take it. So you, any case, be it any case, if it comes to you, take it. See whether you can do it, and have confidence. You only need to know the basics. You can work out, and the intention should always be like see, even for an allopath, let us say they have studied surgery, or they have studied cardiological intervention. Let us say not every case or not every disease listed in that is seen by them. They should know anatomy. They should know the pathophysiology of it. Then they can make correction for surgical disease or for anything. It's not like a doctor who's posted for 2 years attends every possible disease on the earth. What is needed, who excels, is the one who actually knows the anatomy of it, the blood circulation, the the nerve supply of it, how to approach that particular organ, deeper organ, how, in the sense, surface marking is necessary, how you have to approach that organ. You cannot directly cut it. For some things, you have to go from the back, from the front, and from the side, and all those things. If that is known, a surgeon is going to excel. Same way, homeopath also should know the basics, and effort is all that matters. Be it any system, we are not gods, so we should not take it to head. Why I didn't present it in a vague manner is also the fact that, uh, like for example, I didn't mention that I'm only going to present this corona cases or COVID cases itself, because we can do it. Everybody can do it. Put it simple. It is not necessary you are successful in each and every time, but our intentions have to be successful. Our intentions has to be for doing good.
The betterment.
Yeah. So that is what is needed. So that is what I wanted to cover. I hope so. I have made justice to whatever.
Definitely, definitely, doctor.
Thank you for patiently listening to me. And it's a festival day. Sorry for arranging this on a festival day.
Yes, that's extremely sorry for arranging it on a festival day. I hope everyone understands.
It's not very, Dr.
I,
Vasudha.
yes, doctor.
Uh, One small question was there. Would you change medication in second prescription if you feel after repetizing another medicine is more similar, despite the relief with the first one? No, I don't do that. If the first one is working, I just leave it aside and let the action finish, whether it is going to end up in a cure or if needed next time, if they come up with new symptoms, I change it. If anything that happens with the first one itself and it is not represented well in the repertoire, I make a note. Probably I publish the case somewhere. Also, could be then later on in a date made an entry into the uh, repertory or material. That's it. Yeah. So I think it's too late.
Sorry, Monica, I didn't check the Q&A box. That's the only reason I couldn't ask the question. Yes, doctor. With that, I think we'll end the session. Thank you so much, and have a good day. Have a good weekend,
Yeah, you too.
everyone. Yes.
Thank you.
Thank you so much, doctor. Have a good day.